Well, hello, and thank you for joining me today. I've got a very special guest to have a very important discussion with us about pain. Now, pain in the body is something that many people deal with that they probably don't think is connected to other issues that may be affecting their health. I've seen this a lot of times in patients, and Dr. Perry Nickolson is here to discuss why we should stop chasing pain. Perry, thank you so much for joining me today.
Thank you very much, my friend. It's an honor to be on your show. And I love that Stop Chasing Pain. That's the name of my brand, you know.
That's exactly right. And, I saw that with your, when I was first introduced to your work, this stop chasing pain idea, and it just resonated with me so much that because I see this in so many people that they're dealing with these sometimes subtle and sometimes not so subtle pain issues, and they really are not getting the solutions that are, getting to the root cause of the problem. I wanted to dive into your work, and for those in my audience that weren't familiar with you, I thought we could maybe jump into how you first started to think this way. Maybe before you started to, you came up with the term "stop chasing pain," and how are you seeing the world, and what were the cues that you took to start, asking deeper questions?
That's a great question. Well, first of all, I want to make note that it says stop chasing it, not stop treating it. So, we want to treat pain for sure, but it seems like everybody just goes to the next place that they have pain, or they just keep treating the side of pain over and over and over, hoping something finally sticks, right? And I think I've been on this mindset for most of my life, because at least in healthcare, where my degree to practice in healthcare started in chiropractic medicine, which, I still do a little bit of, and I graduated from chiropractic college in 1997. But I was always kind of disgruntled of, I would treat some stuff and it would always come back, or it just needed repetition after repetition after repetition. And I was always like, why did we have to treat the body so much for something to stick? I think the body's way more resilient than that. And who came up with this magic formula that you need a certain amount of visits for this condition that you have? Why couldn't it be just a couple of conditions? Maybe we're just treating the wrong thing, right? Just where it hurts. And so that's where it was born, of always just asking why, not necessarily what we're treating, but why we're treating it. And then that's where I started to branch out, not just treating where it hurt, but a lot of other places too. And then that's when my mindset completely changed.
I completely see, the idea that we're treating the site of the pain. It doesn't make a lot of sense, does it? Because, I see this pattern in patients a lot, particularly with jaw pain and neck pain and so forth, that, they go for adjustments, or they go to a body worker to address, my jaw hurts or my neck hurts. And it's always, or nearly always, the story that it gets better for a little bit, and then it's kind of back, it's worse, or it's still niggling them. So it just seems to me that this pattern really does flow along in how people experience pain. And I really love how you've kind of gone into the question as to why we experience pain. And before we get into that, I thought maybe we could just kind of go through some of the common presentations that really started to open up this world to you, that showed you there was more to what was going on with just pain in a joint or a part of the body. What was some of the symptoms people were experiencing that helped you to draw some of these dots?
Yeah, what's interesting, most people usually only do something when something hurts, right? That pain is the awareness signal, and it tells you, I need you to change something. I don't know what it is yet. I just know that whatever you're doing, I don't like it. That's what the body's telling you. So to me, it's probably important that I tell you my definition of pain. Pain doesn't mean broken. Pain doesn't mean dysfunctional. You got to really be careful of the words that you choose when you talk to someone, because you can help them manifest pain by the way that you're talking to them. That's called the nocebo effect, right? So to me, pain is a request for change. And I love that definition, because it's a request from your body to change something in your life. And to me, it's a habit or a behavior, because that usually led to you having your pain. And it's important to kind of put a category on pain. You have these acute traumatic onset where if you punch me in the face, A equals B. I know why my face hurts. And then you would want to treat that because of the trauma. But if you have a slow onset of my face hurts and I don't know what I did, it's probably not a face problem alone. It's manifesting there, but you need to look a lot of other places. And how do you know? Well, you start where it hurts first and you see what happens and you see if they get better. Here's a dirty little secret. Everything works for a little while. And then, I can make a change in anything pretty quick. I mean, that's what pain medication's in for, and taking a nice shot of alcohol. It'll numb things, but if it keeps coming back, that means you're missing something, right? Assuming that you are ruling out some serious damage or do you need to get this checked and make sure you might not need a surgical intervention, right? I mean, you always have to check several layers. You don't want to disregard pain. It's a messenger signal, but most of the time people only seek when they have musculoskeletal pain, right? Like a muscle hurts or a joint hurts. So it's a musculoskeletal system that they chase. And that's only one system in your body. And it's the least important in my mind. You have a lot of other ones that have to work with that are stuck deep inside of you that we really don't even pay attention to because we don't see it. Right? Like the organ systems of your body, which I work with quite a bit. And in my world, people would come to see a chiropractor for your usual things. My low back hurts. And the low back injuries and pain is going up, not down. So whatever we're doing is not working. So we have to change our thought process. And the amount of money we're throwing at what we're doing on it is not helping, in my opinion. So we attack the back or we attack the shoulder or the hip or wherever it's hurting. And you should, because I want to treat where it hurts. And I do that more so for your mental benefit than mine. So you're like, okay, this guy's not out of his mind. At least he's treating where it hurts, because you think I'm cuckoo out of my head. So I do it to relax your stress level more than anything, but I'm going to look everywhere else. So I've designed my practice where I'm not the first person you see, I'm the last. So I know that everybody's probably done everything under the sun they can think of to your back. And they've ruled out that, okay, you don't have cancer in your back. That's not why it hurts. We've done all these tests and things like that. And they've tried the traditional, normal things that are supposed to work based on what we do and research. Then you come in to see me and I'm like, okay, guess what? I'm not going to do any of that stuff at all, because if you needed it, you wouldn't be standing here asking me for help. So you're paying me for how I think. And I'm going to think way different than anybody else. I'm going to think crazy stuff. But it's not crazy when you understand physiology and human behavior. So I just started to say, you know what? I'm going to start where it hurts and I'm going to look everywhere else. And it initially started just based on studying Eastern medicine of yin and yang, balance. If my back hurts and everybody's chasing after the back, I had a novel idea. Why don't I just check the front and see if anything hurts there? And people would be really startled that it would hurt more than their back. Right? But they didn't know that it hurt until I pushed my finger in there. And that's the alarm signal. So you had more than one pain going on. You just didn't know it because the brain can only feel one pain at a time. And it's going to send it to the one that you give the most perception to for yourself based on repetition. And then I just started to investigate like that, of looking at areas that I don't like to use the word dysfunction. I used to use the word dysfunction, but I don't like that word because I don't really think anything is dysfunctional in the body. I just think there's an unmet need. You see the difference in the words? So there's something that your body needs that it's not getting, and that's why it's telling you that it needs it through pain. And I just want people to know that the unmet need might not be where it hurts. Right? It might be somewhere else. And I usually will find more than one spot. And it's really that simple. It's the definition of insanity. Why do you keep throwing something at one area and it's not making a difference? You need to switch and completely change your outlook and your process and look for other areas or other systems of the body. Does that make sense? That's kind of how it started, of my own frustration of seeing people continuously coming back for the same issue. And I'm like, why is this not resolving? It either I'm missing something, or they're doing something when they leave here that they don't know that they're doing that could be irritating their issue, because you don't know what you don't know and it's not their fault. Right.
Right, and it makes absolute sense. And it's one of those concepts where it's like so bleedingly simple that you can't believe you thought of it when you say it that simply, like you have. And obviously this is what you've kind of put out into your message in your book and in your work that you teach people. But it really does kind of highlight how in in modern medicine we really do try to isolate systems, isn't it? And things are alone. And pain is this funny one. It sits outside, any kind of chronic disease. There aren't many chronic diseases that are described with pain. There are some, not, but most of them you don't talk about much. How the body connects to pain systems. Why do you think we've disconnected this idea of pain and general health, and why because you've just used some very easy common sense that plugged a lot of things together. Why do you think that we've seen it this way?
That's a great question. I ask myself that every day. Like, because I'll be honest with you, pain is a sinkhole. I mean, once you go into that thing, you'll suffocate because everybody's got their own opinion on it. And I think everybody's just as lost as the next guy. We're just throwing darts at a board and see what sticks. Because there's so many things to pain, because they tell you that pain is all subjective anyway, because it changes for each person. And pain is relative based on your history and your perceptions and your biases, which I mean is that you and I could have the same physical experience for something that would be a sensation, right? Like a cut. And then it hurts you more than it hurts me, even though it would be the same circumstance. It's not the circumstance that causes the pain. It's your perception of the circumstance and whether I got cut there before and how my previous experience was before, or last time I got cut, I got infected and I was in a hospital for 6 weeks. You're going to hurt more when you get a cut and you're going to freak out. Right. So pain, what I like is that, it used to be a long time ago where they think that input into A would travel up into your brain and you'd get output B, right? Like it's a Descartes type thing, hand in fire, feel heat, then pull it away. And they know that that's completely wrong. And so there's so many aspects to pain, and they call what's a BioCycle social model of pain, which I happen to agree with, which means there could be a biological reason why you have pain. There could be a psychological reason why you have pain based on your emotions or past trauma, or it could be psychological part of pain because you got so much brain inflammation that you can't wire and fire correctly and your emotions and your hormones are out of whack, or you have the social aspect of pain. And that's your environment, your family, your culture that's handed down to you for generations. So you probably look at pain a certain way because that's the way you were raised in your tribe, right? You got some snowflakes and then you got other people that are tough as nails. So you have to take all of that into consideration. So to me, it's not the incident that is important with the pain. It's the meaning that you take away from the incident after it's over, right? And that's what we have to get back to. Traumatic onset of pain, because that's when you need medicine. You don't come to see me when your arm's hanging off. You get that put back on and then you come to see me afterwards. So everything has its role, but the one that medicine is struggling with and humans are struggling with is this chronic disease, lifestyle disease, autoimmune disease. And I got news for everybody. There's not one cause of that. And that's why we're lost, because medicine likes to look for infection A. Let me give you something for infection A and you don't have to worry about it anymore. It doesn't work like that with chronic disease. You can have so many different factors that come into play, and it's going to change for each individual, which means that two people can have the same diagnosis of fibromyalgia and you got there two completely different ways. So you can't treat them the same. You can't treat fibromyalgia for patient A the same that you do for patient B, because they're different people. They're different and they got there a completely different way. So you have to take that into consideration. And how do you do that? A really novel thing called sitting down with them and taking a really in-depth history and listening to their story, because their story tells you what their tissues are going to do when you start working on them. Right. And then getting your hands on somebody, actually physically touching a patient, which is a lost art in medicine, of how does a person react to what you feel? That's huge. Like I can press on some tissue And it might not be physically painful, but I see you actually go through a really big emotional response when I put my hand, for instance, on your knee. It doesn't hurt. You go, ow, but I can see physiologically that you're going through a stress response, a withdrawal response, a hypervigilance response. In my world, that's huge. In my world, that's a piece of your pain puzzle in your body. So you could be someone, for instance, like who comes in with chronic pain in your right shoulder. And I'm going to look at your right shoulder. But when I check your body and say, for instance, I touched your left knee and I see you really freak out, I know one thing: that knee is tied to your right shoulder. You just don't know it yet. Because you can't have that kind of physiological reaction to that and not have it impact the entire physiology of your body. Because you're gonna try to do anything and everything you can to move away from that area, which means that you might overuse someplace else, like that shoulder. So what I go back to is conversation and history, all the way back as far as you can remember, to things that you think are completely irrelevant, and then touching almost every single inch of your body with my hands to feel the tissue and look at your response to my touch. And here's what surprises everybody: most people have zero awareness of their body until something hurts on it, because the awareness comes from the pain, right? So I do what I call an awareness exam, which means I push on almost every corner from your little toe up to your ear. And what I'm looking for is if it hurts. And if it hurts, I know one thing: there's inflammation. There's an alteration in the way that your body is going to behave and move around that. And I have to pay attention to that. And the more areas that I touch that hurt, the more inflammation you have throughout your entire body, right? And so based on that, I start to go after the areas that I feel for the person I see the biggest reaction for, which typically happens in a couple of places, anywhere around the throat, the chest, or the abdomen. Those are really, really big hot spots in the body for pain, tenderness, and what they call the withdrawal response. All right. And here's the interesting thing. I know I'm going on a rant, but I'm really excited, is that very few people come into my office and say, "Doc, I have to see you. My throat is killing me." And very rarely do they say, "Doc, my chest is killing me." Or they say, "My abdomen really hurts." But they complain of everything else, right? And I thought to myself, that's really interesting. Why is that? Why would people very rarely complain of pain in the front of the body, and it's all in the back of the body? And that's when I started to go and say, well, maybe the brain is doing anything and everything it can to protect the front of the body by sacrificing all the other body parts. Because it innately knows. See, your brain's really smart. It innately knows that from a survival standpoint, if I hit you in the throat, you're dead quick, fast, and in a hurry. If I take your chest out and you can't breathe, you're done. If I hit you in the abdomen, if you have abdominal pain, you're immobilized, can't move, right? And throat pain, chest pain, abdominal pain is like a 10 out of 10 on a scale, and you usually curl up into a ball and you're crying and you suck your thumb and you need an ambulance because you can't move. So your body will do what it can to protect those, but I mean, you can hurt in your back all day long, right? And most people do. It sucks, but at least you'll be able to move. And, so I look at it as your body has to make a choice. I can either hurt your back or your hip or your knee all day long, but I got to do that because there's more important cargo I have to take care of in the front of your body. And here's how I know it, because when you come in to see me, I press on all those regions, and every single one of them, every single person who comes in my office wants to punch me in the face when I push in there. Because it really, really hurts. And here's the takeaway I want to give to you, Doc. They didn't know that it hurt. You follow? They didn't know that it hurt from a conscious standpoint. But from a subconscious standpoint, the brain has always known that it's hurt. It's just not letting you feel it yet is the operative term. And that's really, really important for people to understand. I want to expand on that because you have parts of your brain that are subconscious and conscious, right? Conscious thought, where we're humans and we think we're driving our life by our thought process, but we're really not. Most of it's happening in the subconscious mind in the background for all these pre-programs that you're doing that you don't even know that you're doing. And you need that because if you had to pay attention to everything that was coming into your brain, your head would explode in half a second because it can't deal with all the sensory input. And it negates most of what it feels, or it says, been there, done that, or it just sends it off. And you pay attention to the important things. But when I started to study neurology, here's what I found interesting, right? Is that 10% of your behavior is gone and your movement is conscious driven. So 10% of what you do is conscious driven. 90% is subconscious. So if I'm trying to affect pain, which one should I go after? I'm not going after the 10%. The 10% is where you point your finger. Doc, it hurts here in my back because I consciously feel it. Okay, great. Guess what I'm going to look for? The other 90% you have no idea about, because in my world, that's driving the 10% of chronic pain because that's how your brain works. You follow?
Yeah, so basically you're saying that most pain signals are being misinterpreted as being a much more superficial symptom of a deeper problem, and the way the brain and the body deals with deeper issues. And we'll dive into these deeper issues, but it's fascinating to think, I've never, it's interesting because I see these patterns in the mouth, because often people will be completely unaware with what's happening. They'll say, I've got a hole, and they won't even know sometimes if it's upper or lower. But then when you go close to the tooth or you tap on the tooth, they're like, yeah, that's it. Or sometimes be very vague. And then, so that's kind of, how dentists go about, trying to find, and teeth are sometimes, like there's a big carious lesion there, but sometimes you don't know what's going on. And it's these situations where my mind has been thinking there's a lot more going on, and how we kind of change, the system that the teeth are sitting in, like you say. But, in terms of the whole body, thinking that there are these front centers, you really don't, hear people talking about the throat, abdomen, or front of the body like that. And it's crazy when you think about it. And so what you're saying is that often there will be extremely sensitive pain points in the front of the body when people have reported elsewhere. And these are the examination areas you go to.
Yeah. Well, first of all, it's important to note that pain's the last thing you feel, not the first. Because your body tries to do everything it can to avoid injury and pain, and it's adapting and compensating and doing whatever it has to do to protect you. And it does it, and it can do it for years, right? That's the person. I felt great yesterday, and then today I woke up with fibromyalgia. Probably not, right? It just built up over time. Or today I went out for a run and then my knee hurt, but yesterday it didn't, right? It's just you filled up your bucket of capacity too much, and then all of a sudden it was too much. So your brain has to make a choice of how it's going to try to send you that signal, right? And so I look at it, your brain has one goal, and it's not happiness and joy. It's don't die today. Thank you very much. Check the win box, right? And it doesn't care how it does it, right? Of whether it feels good or whether it makes sense to us or not. Because I always say the human body is under no obligation to make sense to you. It does what it does for one reason: survival and self-protection, which means it has to do the best it can in the moment it's in with what it's got, that it feels is the smartest play, and it worries about the next second when it gets to the next second, right? And at the time, it's a smart move, right? But sometimes we hold on to those patterns that no longer serve us after a period of time, and you get locked in there. And then that's when these repetitive pain patterns keep coming back. It gets locked in the brain, and they call that neuroplasticity, right? Because what happens is when you go through, let's go this way. I talk about the sympathetic dominant survival response, right? Like it's inherent to all animals. It's called fight, flight, freeze, fawn, the 4 F's. So you have a choice when you're under stress, is that, okay, I can stand and I can fight with you, right? Which is usually not the smart play, because even when you can fight, you usually get hurt, and you have a chance of getting hurt and dying. So a smart person says, let me flee, right? So you would run. Smart idea. And if you can't run, you can choose to fight, depending on if you can fight, right? Or you may find it better to, okay, I'm going to get killed here, so I'm going to try not to move, so I'm going to just freeze, which is a very smart survival response, right? But if you start to go in a fight and then you lose, right? So you're going in a fight and somebody is hitting on you and you can't run, right? What position would you probably get into if somebody was beating on you to protect yourself? I always tell people, would you stand straight up, look up at the sky, open your arms and to open to the world and say, do what you want? No, because you'd be dead really fast. What are you going to do? You're going to curl up into a ball. You're going to tuck your neck down. You're going to pull up your knees to protect your abdomen and your groin. And you're going to take your hands and you're going to cover your face and your head. What area of the body are you protecting at all costs? The front. Yeah. And what are you leaving open for me to just kick the hell out of? The back. So your body already tells you what its choice is. I'm going to sacrifice you back to protect the front. And it doesn't matter if it's from an inflammation in your stomach or inflammation in your lymph, or whether I'm going to punch you there. It's still going to do the same thing because it's a perceived threat. Now, this is how I look at the body, right? Because I'm trying to figure out why the body does what it does. So I started to think like my brain and think like my nervous system, not think like a research paper, because they're two different things. All right. Yeah. So I want to see what the smart survival play is, because once I knew that the brain only wants to survive, I figured out the strategy that it does. And it's about doing the best it can in the moment it's in and making the sacrifice that it needs to. So I'm going to treat where it hurts, but I'm also going to look for the vulnerable areas as well, because I know that that's driving your behavior. Right. But it's ever so slight that day after day after day after day. And then one of the things that we know is that when you have excess tension in your body, you don't move as well because you're so tight. Right. So when you don't move as well, you decrease mobility, you decrease blood flow in your body, you decrease lymph flow in your body, and then you start to become stagnant. And when tissues are wrapped in tight tissue like that, you can't get regular cellular function because you shut down flow in the body from tight tissue, because tight tissue doesn't accept blood flow well. And I tell people, you can figure that out on your own. If you make a tight fist and you squeeze it, what color does it become? It usually gets really, really white or flushed out because you're losing blood flow in your fist because there's none getting there. And if you kept it like that for a while, what's going to happen to your fist? Probably going to hurt. And then when you open it up, it's going to be really tight and stiff, and it's going to start to get tingling and numbness because blood's going to start to come in there like that. So what you want to do is just start to get decrease in tightness and tension in the body to get that blood flow going. And a lot of this, honestly, was just me kind of exploring where when people came in to see me, I just thought to myself, okay. And I started to ask questions. When you had this problem here, what kind of stuff did they do to you? What did they do? And where did they treat? And it's really simple. I just went everywhere else but there. And I started to get the experiments that way and the feedback that way. And then all of a sudden people said, you know, doc, this is like the craziest thing in the world, but I got to tell you, I think I'm feeling better. Right. And that's the whole thing. Right. But it's also, I call my exam an awareness exam. I think I may have said this before, because I want you to be aware of how the rest of your body feels, right? And then I also do it for a reason, because when you have chronic pain in one area, you forget about all the rest of your body that probably works really well, and you focus on the 1% that doesn't. So I want to do it to say, you know what? You have 99.9% of your body that's working fantastic. And so I need to reframe your mindset as well to the positive. And here's the thing, doc, is that maybe I won't find this an issue because it's not always the case, but I need to check the box. It's like doing it's like I always say, when you want to take off on an airplane before you fly, they have a checklist and they're going to see if it's checked or not. Right? And if it's not checked, you can't take off until it's checked. That's what I do in my office. So I'm going to flip you over and I'm going to press in your abdomen. And if it hurts, I'm going to check the box. If it doesn't hurt, I'm going to check the box and say, okay, I can move that aside because I know it's not an issue. So I have to make my way through your manifesto. One of the best books I ever read was called The Checklist Manifesto. And it talked about that they used it in hospitals a lot, of making checklists of standard procedures that you could go through. And there were a lot less errors when people went through a checklist and didn't miss anything. So what I do now is I go through a checklist of all of your systems in your body, because in medicine, we always break things down into small specialties or small regions and body parts. That's called scientific reductionist thinking, which is smart in a way, but not so smart, because you have to expand beyond that. Because you can go so far down into looking at one cell, one area of your body. And I'm like, well, that doesn't really help me a lot, because when you take that cell and you put it in a body with a couple of trillion others, it's a completely different ballgame. Like, it's not even close. And it's the same thing with your knee. I'm like, okay, well, I can look at your knee, but how in the world is your knee going to work when you swing it with your opposite arm when you walk? That totally changes everything. And that's how we have to look at the body, because no system ever works alone, even though we look at them alone in isolation, and one specialist doesn't look at another. Like, it was huge for me getting involved with your work, because, you know, nobody ever thinks about the teeth unless you go for your cleaning or you have a cavity. And the teeth are ginormous, you know better than anybody, huge in relationship to the function of the entire body in inflammation and chronic disease. So you have to look there. One of the biggest things I learned from you and I introduced into my work was, when they have autoimmune or chronic disease, ask them about their teeth and their dental health. And I can't tell you how many people I've sent to your work, or I have to send to a holistic type dentist, or have them look deeper. And that was their problem. They had mold in their tooth, in their teeth, or an underlying root canal issue that they didn't know about. And it was messing blew the circuits everywhere. Right?
It's amazing, once really what you're saying is that you're just trying to look at the person as a whole, and, including the, the psychosocial inputs, which, there is some, recognition of that there are mental inputs into how the body works. But it's just such straight common sense that you're talking, that you're just looking at the whole picture, an arm and how it connects to, potentially the opposing leg and so forth. And, when you look at the systems, they all interweave together. And it is really crazy that we've been stuck in this mindset of seeing it separately. However, it kind of is necessary to look at it that way, in a medical way. And then someone like yourself and like a physician that actually comes together and puts all the pieces together, that's really what many patients need. And in the mouth, as you say, there are so many sign points as to how other things are connecting to to what you're experiencing, maybe in the mouth, or maybe it's happening somewhere else. I'm seeing the exact same patterns as what you're describing. Everyone is different, and it's this kind of tapestry of related yet sometimes important, sometimes sometimes people don't have issues with certain things. Some people have infections in their teeth, and they don't have issues for many years, and yet other people will have a chronic problem from it. So it's just it's exactly as you're describing. It's really interesting that your thought processes really do describe how we can untangle this chronic disease epidemic people are really experiencing. One of the symptoms, Perry, that people are reporting to me in the dental chair a lot, and we find relations to the jaw and so forth, are headaches and migraines. Now, we talked a bit about the body and connections, but I imagine that you have a lot of people coming to you with, whether it's chronic or whether it's intermittent headaches or migraines. How do you approach, and what's your take on pain in the head?
That's a great question, right? And yeah, and I love the way that you frame that of tapestry, and I think that's the way you should look at it with your healthcare providers, because the more we work together, the better it is for the patient, right? Because everybody gets into the type of therapies that they're usually doing because they love to do it, or they're gravitated towards it, and they're really trying to make a difference in another human being's life. I just wish that they would more so work together with others, and that's the goal, especially in relationship to chronic pain. Oh yeah, but headaches, man, that's a rabbit hole, right? Because there's so many different types of headaches that somebody can get, and that's really, really important. It's hard to answer that question in a way because it's very specific, but I'll give you my take on it. Absolutely, that's something where huge correlation, as relationship to the teeth and the jaw, but it also comes down to the throat region as well. So I have a lot of people that have issues with the throat itself, where there may have been prior trauma to the throat, or a whiplash injury, or they don't actually move very well in their esophagus, because the esophagus in the front of the throat goes down and travels behind your sternum, drops into your stomach. And whenever you move your head and your neck, your whole esophagus needs to glide up and down, like this, right? Up and down. And it can get stuck at the stomach. It can get stuck behind the sternum, or it can get stuck in the throat. And then that's going to decrease your range of motion in your head and your neck, very small microscopic bit, but enough that can lead up and cause issues with the head and the neck. Most of the time I find it as a fluid flow inflammation issue for people, where they either have lymphatics in the head and the neck from the lymphatic system that are severely stagnated and congested. Could be from some prior trauma that they've had, or could even be that way from the postural biomechanical issues that tighten up tissue. And since you've got about 600 to 700 lymph nodes in your body, which we'll probably get into later depending on the time, is the immune system, kind of sewage system in your body that's supposed to kill bacteria, viruses, parasites, fungus, metabolic waste, cancer, any bad stuff that you don't want needs to get out of there. You've got these nodes that are like mini waste stations, and you got about 600 to 700 depending on the resources, and 1/3 is from the neck up. 1/3. So what does that mean? You better be looking at the head and the neck when people have an issue anywhere in the body, but particularly the lymph. And it can get congested, as you know, around the teeth, underneath the jaw, the deep cervical lymph nodes around the neck that sit along the esophagus and the trachea. And then they drain the toxins from the brain as well. So if they get backed up, brain toxins get backed up, and venous flow in the brain gets backed up through the internal jugular vein right here. And then you have stagnation in the brain, inflammation in the brain, decreased blood flow in the brain, and you can get a headache because you have stagnation here. But I also find, so that's why we do lymphatic work around the head and the neck, and I have special procedures that I do to help drain the toxins from the brain through the lymphatics and through the venous system. Some of that's some craniopathy work. But I also go further down and I start to look at pressure, because a lot of people lose the ability to have adequate pressure in the lungs and in the abdomen because of altered breathing patterns. They breathe too much through the lungs and through the shoulders and the neck, and not enough through the diaphragm. So they have low pressure in one place, high pressure in another place, because your body's all about pressure. And if you get a pressure imbalance there, then that can cause altered flow issues in the body, and you can get a headache. So one of the biggest areas that I see that causes headaches is stagnation of lymphatics in the neck, stagnation of lymphatics that gets stuck behind the sternum where your esophagus is, that takes all the lymph up from the lower body, and it's right in the middle of your sternum because it's called a lymphatic trunk there, and it shifts slightly to the left in the mid sternum to go to the left side of your neck, and it gets blocked there. All right. And the other place is you have a lot of tenderness and tightness and stagnation in the abdominal region, because when you have that much tension and tightness and stagnation, inflammation in the abdominal region, you compromise blood flow through your abdominal aorta or your vena cava, and then that can cause a pressure difference and it'll lead to a headache. Plus, you'll irritate the vagus nerve in your abdomen that goes up to your head, which can change blood pressure and lead to a headache. So what I want people to know is you better be looking at way more than your head. That's my takeaway when you have a headache, because chronic headache people, everybody blasts the head, and you should. And they give you pain medication, which you should, because I don't want you to suffer. So I'm not anti-medicine at all, but I want you to ask why. And then look at those areas and check the box. And I can tell you in my experience, somebody who has chronic headaches like that, I will find another system in the body that's going to be impacted with that. And a big part of that is the immune system. That makes sense?
This is where I love it. Oh, it makes absolute sense. I mean, and you can see the anatomical makeup of the body, and you're just describing in crystal clear description and how it works with, and it makes total sense that you're getting, flow issues that are, potentially, and some of the vessels you're describing are huge. And I actually wanted to get into this with you because you talk about flow of flow problems right through the body, and the vessels you're talking about that run up and down in the abdomen, they're some of the biggest in the body, right? And I imagine right, and no one really talks about how these things are flowing. So I mean, let's discuss that. So we went into lymph, and so not many people think about lymph, and as you say, 30% of the lymph nodes in your brain. So there's a lot of things that your body is trying to drain out of your head, right? So there's a lot of nodes, and in the teeth, even each tooth has its own lymph system, and it's all draining them. So when something gets stuck, you end up with a blockage, and then something along the way, whether it's a tooth pain or whether it's I imagine neck pain as well as is associated with this as well, right?
Oh, absolutely. Big time. Yes, very much so.
So tell us about this lymph flow through the body. We've talked about the 30% in the head. How does the body move this lymph around, and how do people get stagnations? Because as you say, it's the vehicle of which the immune system removes the bad stuff, right? So how does the body move this around, and what's its normal processes, and how do people get stuck on that?
Oh, great question. I love it. I could talk to you for about 18 hours on this one. So I got to be careful because I can go down a rabbit hole. I love lymph. I mean, I'm the lymph doc, and I'll self-proclaim myself that, because working in the lymphatics, I give credit for saving my life and bringing me back from a significant autoimmune issue that I had. I had polyautoimmunity. I had multiple things going on. And the lymphatics were something that were never mentioned to me, and all of my issues that I had for years, I had to find it on my own. And I didn't want anybody to ever have that experience themselves. And I think it's important to kind of talk about the system and make sure that people know, one, it's, like you said, part of the immune system. It's a significant part of your immune system, and it's designed to get things out of your body that are not supposed to be there anymore, called waste. And when waste can't get out, it stays inside of you. And when it does that, it doesn't work out so well. So I tell people, it's like waste in your house. If you go to the bathroom all the time and you couldn't flush your toilet, I wouldn't want to live in your house. It's going to be pretty nasty in there. Well, that's what it's like inside of your body. You just start to decay. But the lymphatic system works directly with your circulatory system. So it's actually part of your cardiovascular system. So it dumps into the veins of the body. So if you have a lymphatic system issue, you also have a blood flow issue, a vein issue. That means you have an arterial issue as well, because those two work together. The two main systems of flow that get rid of waste from your body are veins and lymph. The veins get rid of a significant amount. The lymph takes away the particles that are too large to get out through the veins, mostly protein molecules. So people have excess protein molecules floating around in the system, and it's highly inflammatory. And that's why you get protein molecules called amyloid proteins in the brain that give you neuroinflammation and is linked to Alzheimer's, things like that. But so the lymphatics, dump into the veins, and then the veins dump back into the heart, and then the heart sends stuff back out again through the arteries. So what I want people to realize is they all work together and they run side by side. So if I took a cross section of your body, I'm going to see lymphatic vessels running right next to veins, running right next to arteries, running right next to nerves. So what I tell people is, if you got a problem with one, guess what? You can have an issue with all of them. And then they say, where? And I'm going to say anywhere, because your body is a closed loop system, which means that I can have a backed up fluid flow behind my knee that can cause pain in my right shoulder, because you're always going to have to change and move around blocked points. We call them choke points, stagnation points. And the biggest areas where you have the stagnation of lymphatic flow are around the joints of your body that are supposed to move the most. So they're located behind the knee, in the groin, right around your hip, in your abdomen. Most of the lymphatics in your body are located in the abdomen, in your skin, and in your neck. The other place is in your shoulder and at the top of your neck. So nature's really smart. Why in the world would she put all of those nodes that gather in clusters around the joints of your body that have to move the most? Because movement moves lymph. So what happens if you don't move and you just sit and you're stagnant? Then fluids get stagnant, right? So human movement moves lymph. The other thing that moves lymph is breathing through your diaphragm, which is one of the reasons why we encourage people to breathe in and out through the nose and not the mouth, because when you breathe through the nose, you'll automatically increase more movement and pressure in your diaphragm than in your mouth. So you pump more lymph, because the largest lymph node in your body sits right smack dab in the middle of your abdomen. And guess where it sits? Right where I put my finger and you scream, right there. Okay. And that's also the greatest point of tension when you flex into a ball. And so when that gets blocked, you get stagnant everywhere else in the system. And the lymph gathers. What's important when we talked about pipes is that big pipes in the body become little pipes. So in your abdomen, you have this huge artery here called your aorta. And that's your primary blood flow. That's the origin of blood to all the small things that end up in your feet and in your hands. People don't think about that because they're called different names. And we think because they have a different name, they don't relate to something else. Wrong. Because to the brain, it's one big pipe that just gets smaller. You follow? So when I tell people, I don't want you to listen to the names at all, because they don't mean anything. I just need you to think about the relationships of the names. The names are irrelevant. It's the relationship of the names. So running right in there is the aorta, but running next to that, and that brings the blood flow out. And if that gets a problem with surrounding inflammation, right, or gets what I call a choke point, it can compromise blood flow anywhere throughout the system. But it can also have backflow. So the vena cava, the veins, takes the blood up back towards the neck and back towards the heart. That's where the lymph goes. So all of the stuff that's down in your legs has to go all the way up your abdomen and to your neck and back. It's a long way to go. That's where most people get swelling and inflammation and varicose veins in the legs, because that's the greatest amount of pressure that's there. And veins in the legs, the thing that moves that is moving the calf and moving the legs, right? Because the heart pumps the arteries out, but the blood is pulled back towards in the veins, pulled back up. And then, so you got the veins, and then you have the lymph that runs next to it. If you get the congestion in there, then you can have a compromise in all of those. And so I'll always, to me, the way I look at it is this. Let's say you have an injury to your left ankle. You're going to get pain. Pain just is going to be inflammation. And you're going to have, what are you going to have when you get an injury to your ankle? Swelling and inflammation. What's the system that is swelling and inflammation? That's the lymphatic system, right? And you're supposed to get swelling and inflammation because it's going to come in and flush it out and bring all the immune cells to kill the stuff there. And then it has to get the waste out. So when you damage cells you create waste, right? And where's that waste got to go? Out of your body. And then I tell people, how's it going to get there? It's got to get there through your veins and through your lymph, right? So it's got to go from there, behind your knee, to your groin, in your abdomen, up your sternum, and go to your neck. It's a long way to go. Okay? What if you're blocked in your knee, your abdomen, or your groin, and it can't get up? Where's it going to go? Nowhere. It's going to stay right there, right? And if stuff can't get out, you may struggle to get stuff in. So what brings the nutrients to the damaged area so it can heal? Arteries. Where does that come from? Your abdomen and your groin and down your knee. Same way, same pathway. So whenever you have an injury to the body, you need to recover and regenerate, repair it. And here's the thing. You got to make new ones. Because that's called resiliency. That's called regeneration, right? Because otherwise we'd be dead yesterday if you can't make new cells. So in my world, I'm thinking to myself, well, what in the world do you need to make new cells that work? And how do you get rid of old ones? Flow points, right? Flow points. So all I do is I check the flow points, right? So let me bring this home for you. If you come in to see me and you have chronic pain in your ankle, I don't do anything into your ankle until I check all the flow points down to your ankle. So if I push on your sternum and you scream, choke point. If I push in your abdomen and you scream, choke point number 2. If it's in the groin, choke point number 3. And then what I'm going to tell you is that it doesn't matter what I do to your ankle. You're always, this is the coolest part, Doc, because I've always been at, why in the hell does stuff keep coming back? If I treat the ankle and it keeps coming back, why? Maybe because it doesn't have what it needs to completely heal itself. So let me give it the ability to do that and remove the choke points. And when I do that, you typically feel a lot better because now, you know, the body knows how to heal itself. We just got to give it what it needs to do so, and sometimes get out of our own way and let it happen that way. So I just started to think not in isolation body parts and think of the bigger picture. But once again, we get back to it because somebody say, what in the hell does your abdomen or your liver have to do with your ankle? And I'm like, dude, it's got everything to do with there, because if your liver gets backed up and it's stagnant, you can kiss your vein flow goodbye. And your lymph is going to get overloaded, because if your liver is overloaded, you release 2 to 10 times more lymphatics into a system that can't handle it. And then you got to throw an injury on top of that. You have to look at the bigger system, and you got to check all these boxes off. Otherwise, you're going to get lost.
It really does make so much sense when you think of it in this simplistic way. You know, you're just describing very, very clear anatomical concepts and how it all flows and works together. Really interesting about the autoimmune point. What's your take on the contribution of the body being unable to clear lymph on autoimmunity? What's your take on that?
Yeah. So remember, this is all just me with my theory and what I'm working with, because I mean, there's no research yet to back it up, because unfortunately, you know, lymphatics were so neglected for so long that they're now starting to come around, because it's like, whoopsie daisy, we kind of missed a big one here, because they're seeing that the lymphatics has a huge amount to play with brain health. Because listen, it used to be a short time ago when, first of all, they didn't even think your brain could change itself. They didn't believe in neuroplasticity. They thought you had this thing, and when it goes, that's it. All right. That's a big whoops that they missed on that one. And then they also said that there's no it's immune privilege up here. There's no lymphatics here. They got that wrong too. They're connected. Because I just think if nature's going to put 1/3 of your lymph nodes in your head and your neck, that probably means they're trying to drain your head and your neck and your brain down there, right? So in my world, the way I look at it is an autoimmune disease. First of all, it means they got no freaking idea why you're sick. That's what it means. And auto means with you, like your body just decides to turn on itself. I don't believe that at all. I think it just gets maladapted to something, and I think it works too well. Does that make sense? So the immune system is just going crazy on something, and it just doesn't know any different yet. So it gets what we call maladapted. But autoimmune is inflammation, right? And there's a lot of different things that can cause inflammation. One are toxins that come in from the outside world, just from living on this planet, right? With what we do as human beings and your culture, not to mention the toxic thoughts that you have, that you plant in your own head or somebody plants into there. So it's inflammation in the system, and people are trying to calm down inflammation through medication. But the inflammation is an immune system response. It's a neuroimmune response. And then I look back, okay, well, what's the number one system that eliminates inflammation? The lymphatics, right? So it's a huge player in relationship to your body's trying to give an inflammatory process to attack something. And we have to figure out what that is and why it's doing it. Because the one thing that I need people to understand when they have a lymphatic system issue is that sometimes the lymphatic, when you work the lymphatics, it can come back, right? Like it's supposed to come back. I mean, you're supposed to get swollen and then not get swollen and feel good and then get swollen again. You want them to work. That's why your face gets all puffy when you get strep and stuff like that, right? Or when you get a shot in your arm and then your lymph nodes in your pec swell up in your armpit. It's attacking an outside invader. But when the lymphatics keep coming back over and over and over, it's not a lymphatic system problem because the lymph's just doing its job. You have to figure out, okay, well, why does the lymph keep coming back to protect me from? And so it's usually something going on in the body with an outside toxin. It can be an underlying infection. It can be a parasite. It can be a sympathetic dominance, fight, flight, freeze, freak out, high cortisol state. So you're always in stress mode as well. So there's many different players that would come in you'd have to look at based on somebody's history on that one. But I think I'm really, really excited for the research that they're going to be doing on lymphatics because I've known for a while, and I think that medicine is starting to see through their research that they're going to be like, this lymphatic system stuff's kind of important, man. I mean, we're seeing some crazy changes in here. And it's something that they discovered many, many years ago, but they just I don't pay attention to that unless you got cancer or unless you got lymphedema, which means you have a body part that gets swollen and really, really swollen and nobody knows why. But nobody ever really looked at it except for those two cases. And I think it's everything. I think it's going to be a piece of the puzzle. I say in my office, I jokingly say that, if you're standing in front of me asking me for help, you got a lymphatic system issue. I just need to see how much and how deep it goes and how it relates to all of the other systems of the body. And so this is where a lot of people say, well, I breathe all the time. I do diaphragm breathing. I teach people how to move, and I move all the time. Shouldn't my lymph be good? And I would say, yes, the operative word is should. But sometimes it's so overloaded that's not enough anymore. You have to manually go in there and then release those. Just like the toilet. Sometimes the toilet gets backed up and you can't flush it because there's not enough pressure to move it. You got to go in there and you got to snake the toilet, plunge the toilet. You have to do the same thing with your lymph nodes. And then that's the stuff that I try to teach people just to be aware of it. Because one of my favorite phrases is you can't change something until you become aware of it. So my job is to make people aware of the lymphatic system and the roles it plays. And that's why I also have the awareness exam, because you can't change areas of your body that hurt if you don't know they hurt.
Absolutely. And, I completely echo that point on lymphatics being, it's going to be the next big step because it's already there in terms of, neurodegeneration, what we know about sleep apnea and the brain being unable to clear itself at night when we're not breathing correctly. And, when you're trying to get the lymphatic system of the brain to work properly, it just really, this discussion has really highlighted to me how we really need to start thinking about how all this is flowing through the body as well. It's just crazy.
That's really important, doctor. You mentioned that. I'm glad you did. I mean, I call lymph the new fascia. Because nobody paid attention to fascia at one point either. Now it's fascia, this, everything. I think lymph will be the same way. And what's really cool is I've studied from people in Italy, particularly Bruno Bordoni, and he calls lymph and blood liquid fascia, which is very cool. But that's where I really want to send a point home, is that many people will separate the head and the neck lymph from the body lymph. You can't do that. So you can't just do head and neck lymph and then get the brain drainage that you need without working the rest of the pressure system for the rest of the body. That's why in my work, I don't do isolated lymph work, which means that you could have a swollen left leg and most people will just work on the swelling in your left leg. I don't do that. I do all the whole system, because I know that these pressure things work together, and you're only going to be as strong and resilient as the most vulnerable lymph node that you have. And it doesn't have to be where most of the swelling is. And that's where people can get lost. So I started to do head and neck work. I do a special lymphatic brain advanced head and neck course for this up in here. And I combine that with knowing the basics of the lower body first. So I have to clear the lower body before I do up. I found that to be much more successful.
Makes total sense. There's so much, Doc, that we could cover. I thought just before to round this out, you do talk about specific organs and how they relate to pain. And we've kind of touched on how important the liver is. And the liver is such a pivotal organ for both storing and sending critical nutrients out to the body, but also to clearing aspects of toxins and so forth that the body needs to deal with. I think we really underestimate the process of the liver and some of the organs around it too. How have you found that pain manifests in terms of issues with organs like the liver or the spleen and so forth?
Oh, that's a great question, man. Yes, that's a good question. I get so excited. It's really funny. You ever see that movie Jerry Maguire? When she goes, "You had me at hello." I always tell people, you had me at lymph and you had me at organs. Like, I'm all in. Yeah, so the poor liver, man. I mean, that is a workhorse. It's the largest organ inside of your body, unless you talk about fascia, because they're calling that an organ now, in the interstitium. But I mean, that's the big dog that detoxifies everything that goes in your mouth. It's got to go through that liver. So first of all, you should think about what you stick in there, right? And nobody ever really pays attention to it, and until you have an issue. And I personally think that everybody's got some type of liver stagnation, overload. It's just not working at its optimum, because we hit it with so many things that come at it, and for it to keep up. And then it goes through its detoxification. They call it phase 1 and phase 2. And a lot of people have some compromise in that. Sometimes it could be a genetic component through methylation that some people might know when they're listening to this. But the liver has a lot of ligaments that attach to it, a significant amount that attach to your diaphragm. So that's why breathing through your diaphragm is the number one way to move your organs. So if you breathe through your diaphragm, you automatically move your organs. And what's interesting that I find is that there's a ligament that goes from the liver to your navel. And then, so a lot of people get tightness and restriction in the liver and around their navel, and then that can manifest pain through the hips and to the shoulders. So when the liver doesn't move well, it can get stuck up underneath the side of the right rib cage, and it goes over all the way over to a little bit on the left side of the rib cage by the stomach and the pancreas. Is that you can lose some motion in your hip on the right, and you can lose motion in your shoulder on the right. Because if you think about this, if you reach your shoulder up high over your head, you have to elongate and open up the rib cage on the right, and then the liver has to move. And if it's stuck there, you won't be able to move the shoulder as much. So what you'll do is you'll hike the trap and you'll tilt your body to do it. It could be just like 2 degrees difference, but 2 degrees difference over years is going to add up. And then, so the number one referral area for the shoulder, for the liver, is the right shoulder. And so shoulder pain can manifest there. It has been linked to frozen shoulder syndrome as well. and visceral manipulation and osteopathic visceral manipulation, according to Jean-Pierre Barral, who I've studied his work. And so in the liver, dumps the most lymph into the system. The liver is the biggest lymph organ that you've got, right? So that tells you something. And emotions can get tied to organs as well, particularly when you study Eastern medicine and Ayurvedic medicine, which I do. And the number one emotion to get held in the liver is anger. So people that have a stagnation in the liver can manifest anger emotions. People with anger emotions can manifest liver type issues. You see that a lot. And the spleen is a huge one because nobody really pays attention. The spleen's like, what about me? Yeah, because we figure in medicine that, well, we can take it out if it bursts, or you can live without it. So it's really not that important. Well, anything that nature puts in you is important. You can live without it, but you're not going to function as optimal because the liver is a huge part of your lymphatic system. It's a major part of your immune system. And the spleen is designed to remove old, dead red blood cells that you have floating around in your body and give you more white blood cells, right? So if you have stagnation in your spleen, then you actually get increased viscosity in your blood because you have too thick blood because you can't get rid of the old dead red blood cells, and the liver is supposed to help you with that, but the liver gets overloaded. So the blood gets thicker and it takes more pressure to move the blood, and the blood can't get through the endpoint capillaries to deliver the nutrients to the cells because you got a spleen problem. You follow? So when you get in there and you move those organs through breathing or jumping up and down, called rebounding, I don't want you to think anymore just about cardiovascular training. I don't want you to think just more about blood flow. I just want you to think about what you're doing to your organs, because humans don't jump up and down anymore, right? And we should. It's one of the most effective rehab tools that I give to anybody. I'm like, Doc, I don't have time to do any corrective exercise. I'm like, okay, can you jump up and down on the balls of your feet for 1 minute, 3 times a day? Yes or no? Yeah, I can do that. Perfect. I want you to start there, right? And then it makes a huge difference. And then I combine that with showing them how to massage those lymph node regions and then jump up and down. I'm going to change your life, right? Because I need you to think of the bigger picture about how these things work together. Because in medicine, they don't think you have a problem with an organ until you're doubled over in pain or something shows up abnormal on your blood work. And very often, stuff doesn't show up on blood work when you have issues. And because this is arbitrary, pendulum of whether it's good or bad. And, you're at 0.8 and you're fine. Then when you're 0.9, you're not. Like, there's a build-up process to that. So you need to look at overall function, not just because it didn't show up on blood work doesn't mean everything's functioning well. Because so many people, how many people come in to see you or listening have normal blood work and normal tests and you can't get out of bed?
The amount of times I see that, yeah, it really is. You're talking probably about 80% of people that have conditions and then they have normal testing. It really is, what you're talking about there is that, that you've got, you might be able to have see a measurement, on a piece of paper, but how is it working in the body? And this is it. It makes total sense there, and the way the liver uses all these different all these different points, and the spleen as well. How can they function if they're not moving correctly? It really is fascinating. One more question just before we go. I wanted to, what's your take on why do you think so many ligaments are tied to the liver like that? Like, what do you think the function of that is?
It's a great question. So I always think about it this way. The body's pretty smart. It's like the ankle. Why do you have a lot of ligaments in your ankle? Because you're supposed to move your ankle a ton and be able to maintain control of it at the same time, right? So when you have that many ligaments to your liver, that means your liver should be moving a ton, a lot. And the primary mechanism that does that, one, is breathing through your diaphragm. to walking and rotating when you walk. Not walking with your phone in your hand and you're not swinging your arms and you're not looking at the world. That's not walking, right? Because the liver is supposed to move, in all different directions, and it moves a significant amount, or it should. So I have a lot of people that have got sticking up in that region, or they've got a little bit of swelling in the liver, or which is becoming very prevalent in the United States is non-alcoholic fatty liver disease, which many, many people suffer from because of the poor diets that we're doing. And so the liver actually gets larger, fatty liver. And then that's going to compromise how you rotate in your torso. And when you have underlying inflammation in an organ, that inflammation, the protective response kicks in from your brain. And what's the protection response? The tightness or withdrawal. So you get tightness in your low back. You'll get tightness in your hip. You'll get tightness in your abdominal obliques on the right. Very microscopic, but enough to change your movement pattern over time. And then it's like water dripping on a rock. Eventually, you just start to see it just blast away the rock until one day you come on in and you say, Doc, my right hip and my right shoulder are killing me. And I'm like, did you fall? No. I don't know what happened. Then that's when the investigation starts. Because I'm going to tell you, if you just go after the hip and you just go after the shoulder, you'll make a difference. But you probably won't make a long-term difference because you need to look at all the other systems. Does that make sense? So the liver, the poor guy, if you just show him a little bit of love, that'll change your life. Because one of the things that you'll notice when people have liver issues, one, the emotions go out of control, but two, they'll usually start to manifest skin issues. So the skin always shows you turmoil on the inside. So if the skin goes, you know something's up on the inside.
And you mentioned twisting. So do you think twisting exercises are ways to get the liver? Is that specifically how, or is it the jumping that's better for the liver?
Both. Well, I always call it the novelty, variation, variability, and variety. And people say, which way are you supposed to move? Yes is the answer. Like, I want you up, I want you down, I want you twisting. But human beings are designed to rotate. Right. So all the tissues in your body are spiral. Even your DNA is spiral. So that's why I like to do Qigong type exercises and Tai Chi, because if you just, you stand and you just twist and you turn and you move your body, because human beings usually don't twist. Right. And we usually don't jump up and down. We sit and we push and we pull if we're lucky. And then, we're very linear with our motions. And now when we walk, like I said before, we don't really walk because you're walking with a phone in your hand. So you're removing either one hand or two hands from the equation, and you're looking down, and you're going to alter your breathing, and you have zero awareness of your surroundings, and you're not going to rotate over time. And that builds up. So that's why going for a nice brisk walk where you can have a nice pace that you'll twist and you'll turn. And it just so happens that brisk walking is one of the best ways that you move lymphatics at the same time. So I have a novel idea. I tell people, I said, why don't you, jump up and down and do a brisk walk, right? You mix those two together. One of my favorite ones that I teach is a Qigong move where I have people just stand, they put their legs about shoulder width apart, have a nice relaxation stance in their knees, a little bit bent. Best if you have no shoes on, so you can really get good feedback from the ground. And if you really want to go crazy, do it outside on this big spinning ball called the earth and get some good electrons through grounding, and just start swinging and let your arms kind of whip out like wet noodles. And they just come around and they just slap the front and back of your body as you swing like that. And that'll really open your whole body up and get some fluid motion. And you'll probably have a really, really great time when you do it. And it's very, very simple. And one of my favorite phrases that I tell people is the effective things don't have to be complicated. And medicine is great, but medicine also likes to overcomplicate the hell out of everything. And the human body is a complex system, which means that systems work together, but it doesn't mean it's complicated. We have a tendency to make it that way.
Yeah, we certainly do. And, you have such a great skill of simplifying it and making it easy to comprehend, but also to, these are very, as you say, intertwined and complex systems. But if we help them work together, with simple approaches, it really is effective. Perry, I want to thank you so much. I'm just looking at my list here in terms of what we wanted to talk today. We barely scraped the surface, so we're gonna have to do this.
That's because I just kept talking. I'm sorry, man. You hit the go switch on me, and I'm sorry. I just like I
no,
just keep
but it was all gold. So I enjoyed every second of it. So I just mean we're gonna have to do this at some other point because your work is really great. I love it. Thank you so much for all the everything you've done to help people connect to how they can get rid of pain. Where can they find you to find more about your information, take your courses and your book?
Yeah, great. Well, it's really easy. You just go to stopchasingpain.com. That's my website. That's the central hub that will link you to all of my social media stuff, workshops, my own podcast that you were a guest on that posted this week. So everyone who follows Dr. Lynn here, make sure you go listen to the Stop Chasing Pain podcast that he was on. Feedback on that's already been fantastic. So thank you. Yeah. And I think the place that I spend the most time, I like to call it my healthy addiction, is Instagram. So you can follow me on there on stopchasingpain.com. And I'd love to have you there.
Yeah, I love your post too, because it's as this conversation was, you get to the point and we really take practical advice out. Perry, thank you so much for spending the time. I look forward to talking again, and we're going to go into some rabbit holes very, very soon.
Yeah. Thanks, Doc. Bye, everybody. Thank you.
Have a good night.
You too.